My name is Alex Murray, and I'm a third-year medical student at OSU here in Tulsa. My co-author is Kylie Honda, and she's also a third year at OSU. Our project is titled Medical Home Status Among Children with Asthma. Asthma is a chronic lung disease that affects nearly 5 million children in the United States. It's a disease that typically presents with exacerbations of difficulty breathing after exercise or exposure to an allergen. These exacerbations can be very scary for both children and their care providers. Due to the majority of exacerbations occurring when children are not in a place with access to medical providers, it's important that caregivers are ready to intervene when necessary. A medical home is defined as having a primary care provider that offers an inclusive experience for patients with management of all medical problems, medications, and referrals, while also providing an environment that exhibits patient and family-centered care. We chose to conduct a cross-sectional study using the National Health Interview Survey from 2022 cycles that assessed how asthma severity changed when a child is in a medical home versus when they are not. We also explored how various sociodemographic factors impacted medical home status among children with asthma, specifically race or ethnicity, caregiver education, family structure, and neighborhood safety. We compared access for each component of medical homes between children with asthma using design-based chi-squared tests. Asthma severity was assessed by ranking symptoms either mild, moderate, or severe. Results showed that of the 3,636 children who carried a diagnosis of asthma, 41.5% of them met criteria for a medical home. We found significant associations between all variables tested, with p-values less than 0.001, except age. Children who rated their asthma symptoms as severe were much more likely to not be in a medical home compared to those who ranked their symptoms as mild. Regarding ethno-racial groups, results showed that patients who were white were the most likely to be in a medical home, while those who were Asian were the least likely. Results regarding caregiver education showed that children whose caregiver had a college degree were significantly more likely to be in a medical home compared to those whose caregiver had less than a high school degree. Family structure also had a significant impact on medical home status. Children who had two married biological parents were much more likely to be in a medical home compared to those who either had divorced, not married biological parents, single parents, or grandparent households. Lastly, rankings of neighborhood safety showed that children who had responses of "definitely agree" to the question, "Is the child safe within the neighborhood?" were significantly more likely to have access to a medical home compared to those who answered any of the other choices. We concluded that of the 41.5% of children who were in a medical home, only 1 out of every 5 had severe asthma symptoms. This shows that access to a medical home did improve rankings in asthma severity. There are several sociodemographic factors that significantly impact the likelihood of children with asthma having access to a medical home, especially neighborhood environment and family structure. Because access to a medical home is shown to have lower ratings of disease severity, we have concluded that national and state policies are needed to enhance access to medical services among all children with asthma. Thank you for watching.